Top 7 Nutrients for Strong Legs, a comprehensive guide to mobility and strength. Imagine waking up each morning with legs that feel powerful, stable, and ready to carry you through the day. Whether it's a brisk walk in the park, dancing with loved ones, or simply moving around your home with confidence. As we age, maintaining leg strength becomes increasingly vital for preserving independence, preventing falls, and enjoying an active lifestyle. Weak muscles, painful cramps, or balance issues can make even simple tasks feel daunting, but the solution often lies in something as fundamental as nutrition. In this comprehensive guide, we'll explore the 7 most essential vitamins and minerals that strengthen your legs, boost mobility, and enhance overall well-being. From supporting muscle function to protecting bone density and improving circulation, these nutrients can transform how you move and feel every day. Let's dive into the science, benefits, and practical ways to incorporate these powerhouse nutrients into your life. 1. Vitamin D, the cornerstone of leg strength. Why vitamin D matters. As we age, our bodies undergo natural changes that affect mobility. Muscle mass declines, bones lose density, and movements that once felt effortless can become challenging. One of the most common yet overlooked culprits behind these changes is a deficiency in vitamin D. Often called the sunshine vitamin, vitamin D is far more than a bone health nutrient. It's a critical player in maintaining strong, balanced, and functional legs, particularly for older adults. Vitamin D supports leg strength in several ways. First, it enhances calcium absorption, which is essential for maintaining bone density and preventing fractures. Second, it directly impacts muscle function by improving protein synthesis and neuromuscular communication, ensuring that muscles contract efficiently and respond quickly to maintain balance. Research published in the Journal of Clinical Endocrinology and Metabolism highlights that seniors with adequate vitamin D levels have stronger muscle fibers, better coordination, and a lower risk of falls compared to those with deficiencies. Conversely, low vitamin D levels are linked to muscle weakness, slower reaction times, and an increased likelihood of injuries, including fractures. The risks of deficiency. Vitamin D deficiency is alarmingly common, especially among older adults. As we age, our skin becomes less efficient at synthesizing vitamin D from sunlight. Many seniors also spend less time outdoors due to mobility limitations, lifestyle changes, or concerns about skin damage from UV exposure. This combination often leads to a silent but significant deficiency that erodes muscle strength and stability over time. Studies indicate that low vitamin D levels are directly associated with an increased risk of falls, which can have devastating consequences, such as hip fractures or loss of independence. Beyond mobility, vitamin D deficiency is linked to serious health issues, including osteoporosis, heart disease, cognitive decline, and weakened immunity. For example, without sufficient vitamin D, calcium cannot be properly absorbed, leading to brittle bones that are highly susceptible to breaks. A minor stumble could result in a major fracture, drastically affecting quality of life. How to boost vitamin D levels. Fortunately, optimizing vitamin D levels is straightforward and can yield transformative benefits for leg strength and overall health. Here are the most effective strategies. Sun exposure, spending 15 to 30 minutes in direct sunlight, preferably in the morning or late afternoon, allows your skin to produce vitamin D naturally. Exposing your arms and legs maximizes absorption, but be mindful of sunscreen, as it can block vitamin D synthesis. Aim for a balance between safe sun exposure and skin protection. Dietary sources. While food alone may not meet daily vitamin D needs, incorporating vitamin D-rich foods can help. Fatty fish, salmon, mackerel, sardines, fortified dairy products, egg yolks, and certain mushrooms, like maitake or chanterelle, are excellent choices. Supplements. For many seniors, especially those with limited sun exposure or dietary restrictions, vitamin D supplements are essential. Most experts recommend 800 to 1,000 IU per day for optimal bone and muscle health, though those with severe deficiencies may require higher doses under medical supervision. A simple blood test can measure your vitamin D levels and guide supplementation. Practical tips. To make vitamin D a part of your routine, try incorporating a morning walk to combine sun exposure with weight-bearing exercise, which further supports bone and muscle health. If you're considering supplements, consult your doctor to ensure the correct dosage, especially if you have conditions like kidney disease that affect vitamin D metabolism. By prioritizing vitamin D, you can strengthen your legs, reduce the risk of falls, and maintain the mobility needed for an active life. 2. Calcium. the building block of bones and muscles. The role of calcium. Calcium is widely recognized for its role in bone health, but its importance extends to muscle function, making it a vital nutrient for strong legs. As we age, bone mass naturally declines, increasing the risk of fractures in critical areas like the hips, femurs, and lower limbs. These injuries can lead to months of recovery or even permanent mobility loss. Calcium helps maintain bone density, ensuring that your legs remain structurally sound and resilient to stress. Beyond bones, calcium plays a crucial role in muscle contraction. Every movement, whether taking a step, climbing stairs, or standing up, relies on calcium ions triggering muscle fibers to contract and relax smoothly. A calcium deficiency can lead to muscle cramps, weakness, and reduced endurance, making daily activities more challenging. For seniors, these symptoms can significantly impact mobility and quality of life. Consequences of calcium deficiency. Without adequate calcium, bones become brittle, increasing the risk of osteoporosis and fractures. A minor fall that might have been harmless in youth could result in a serious injury in older age. Additionally, low calcium levels can cause muscle cramps, sluggish movements, and overall reduced muscle performance, making it harder to maintain stability and prevent falls. How to ensure adequate calcium intake. To keep your legs strong and healthy, aim for a balanced approach to calcium intake. Dietary sources. Dairy products like milk, yogurt, and cheese are rich in calcium, but they're not the only options. Leafy greens, kale, bok choy, almonds, tofu, sardines with bones, and fortified plant-based milks are excellent alternatives. Variety is key to ensuring steady absorption and meeting daily needs. Supplements. If dietary sources are insufficient, particularly for those with lactose intolerance or dietary restrictions, calcium supplements can help. Aim for 1,000 to 1,200 milligrams daily, ideally paired with vitamin D to enhance absorption. However, avoid excessive supplementation, as it can lead to calcium deposits in arteries, kidney stones, or digestive issues. Exercise. Weight-bearing exercises like walking, resistance training, or light jogging stimulate bone remodeling, directing calcium to where it's needed most. Without movement, even adequate calcium intake cannot fully strengthen bones. Practical tips. Incorporate calcium-rich foods into every meal. Try adding kale to smoothies, snacking on almonds, or including sardines in salads. If using supplements, split the dose, e.g., 500 to 600 milligrams twice daily, to improve absorption and reduce side effects. Consult a healthcare provider to determine your ideal intake, especially if you take medications that affect calcium metabolism. By prioritizing calcium, you'll build stronger bones and muscles, ensuring your legs remain capable and resilient. 3. Vitamin B12, the nerve-muscle connector. Why vitamin B12 is essential. Vitamin B12 is a critical nutrient for maintaining healthy nerves and muscles, yet its role in leg strength is often overlooked. B12 ensures that electrical impulses traveling from the brain through the spinal cord to the leg muscles are strong and precise. Without it, muscles may not receive the right signals, leading to weakness, instability, and a loss of control over movement. Common symptoms of B12 deficiency include heavy, tired legs, numbness or tingling, which many seniors mistake for normal aging. B12 deficiency is shockingly common among older adults due to reduced stomach acid production and lower levels of intrinsic factor, a protein needed to absorb B12 from food. Conditions like gastritis, acid reflux, or long-term use of antacids can further impair absorption, while diets low in B12-rich foods exacerbate the problem. The impact of deficiency. Uncorrected B12 deficiency can lead to serious neurological issues, including irreversible nerve damage, poor coordination, and an increased risk of falls. Many seniors who struggle with frequent falls or difficulty walking may be experiencing the effects of low B12 levels, which are entirely preventable with proper attention. How to boost vitamin B12 levels. Restoring B12 levels can significantly improve leg strength, endurance, and mobility. Here's how to ensure adequate intake. Dietary sources. B12 is found almost exclusively in animal products, including lean meats, fish, eggs, dairy, and shellfish, especially clams and liver, which are among the richest sources. For vegetarians or vegans, fortified cereals, plant-based milks, or nutritional yeast can provide B12. Supplements. For those with absorption issues or dietary restrictions, B12 supplements or periodic injections are highly effective. B12 is one of the safest vitamins to supplement, as excess amounts are excreted in urine. Regular blood tests can help monitor levels and guide supplementation. Practical tips. Incorporate B12-rich foods into your diet by adding eggs to breakfast, fish to weekly meals, or fortified cereals as a snack. If you suspect a deficiency or have digestive issues, consult your doctor about testing and supplementation. By maintaining optimal B12 levels, you'll support nerve health and muscle function, ensuring your legs remain responsive and strong. 4. Magnesium, the muscle and bone balancer. The role of magnesium. Magnesium is a master regulator of muscle function, ensuring that muscles contract and relax smoothly. It's also vital for bone density and joint health, working alongside calcium to maintain skeletal strength. Magnesium deficiency is a common cause of restless leg syndrome and nighttime leg cramps, which can disrupt sleep and hinder recovery from daily activities. Magnesium also helps calm overactive nerve signals, reducing muscle spasms and tension. For seniors, this can mean fewer cramps, less stiffness, and improved endurance. Additionally, magnesium ensures that calcium is properly incorporated into bones, preventing deposits in soft tissues that could lead to joint pain or stiffness. Why deficiency is common. Magnesium deficiency is widespread due to factors like stress, certain medications, e.g., diuretics, proton pump inhibitors, and diets low in magnesium-rich foods. This deficiency can lead to a gradual loss of stamina, making activities like walking or climbing stairs feel more taxing. How to increase magnesium intake. Replenishing magnesium levels can have an almost immediate impact on leg health. Here's how to do it. Dietary sources include magnesium-rich foods like leafy greens, spinach, Swiss chard, nuts, almonds, pumpkin seeds, whole grains, legumes, and avocados. These foods are nutrient-dense and support overall health. Supplements. For those who struggle to get enough magnesium through diet, supplements like magnesium citrate or glycinate are highly absorbable and effective. Consult a doctor to determine the appropriate dosage. Practical tips. Add magnesium-rich foods to your meals by tossing spinach into salads, snacking on almonds, or blending avocados into smoothies. If using supplements, start with a low dose and take it with food to minimize digestive discomfort. By prioritizing magnesium, you'll reduce cramps, improve muscle function, and support stronger bones. 5. Potassium, the cramp fighter. Why potassium matters. Potassium is a key regulator of muscle function and fluid balance, preventing painful cramps that often strike the legs, especially at night. It also supports nerve signaling, ensuring smooth, controlled movements. Low potassium levels can cause muscle weakness, trembling, or stiffness, increasing the risk of falls and making mobility more challenging. Potassium also plays a surprising role in bone health by neutralizing acids that break down bone density, reducing the risk of osteoporosis. A potassium-rich diet supports both the muscles and bones in your legs, ensuring they work together harmoniously. Consequences of low potassium. Muscle cramps are one of the most common signs of potassium deficiency, but the effects go beyond discomfort. Low potassium can lead to shakiness, difficulty lifting the feet properly, and reduced muscle endurance, all of which heighten fall risk. How to boost potassium intake. Fortunately, potassium is abundant in many delicious foods. Dietary sources incorporate bananas, sweet potatoes, avocados, spinach, beans, oranges, and baked potatoes with the skin. A single baked potato can provide more potassium than a banana. Recommended intake: aim for 2,600 milligrams, women, or 3,400 milligrams, men, daily through a balanced diet. Those with kidney disease or other conditions affecting potassium levels should consult a doctor. Practical tips. Add potassium-rich foods to your diet by including a banana in your breakfast, sweet potatoes as a side dish, or spinach in smoothies. Monitor your intake carefully if you have health conditions that affect potassium balance. By ensuring adequate potassium, you'll keep cramps at bay and support strong, stable legs. 6. Vitamin K, the calcium director. The role of vitamin K. Vitamin K is a critical yet often overlooked nutrient that ensures calcium is deposited in bones rather than arteries or soft tissues. This traffic controller role helps maintain bone density, reducing the risk of fractures. Vitamin K also supports joint health by reducing inflammation, which can alleviate knee stiffness and slow the progression of osteoarthritis. Emerging research suggests that vitamin K also aids muscle strength and coordination by regulating calcium levels within muscle cells, supporting proper contractions and stability. Why deficiency matters. Low vitamin K levels are associated with weaker bones, higher fracture risk, and reduced joint flexibility. For seniors, this can mean increased difficulty walking or climbing stairs, as well as a greater likelihood of falls. How to increase vitamin K intake. Vitamin K comes in two main forms, K1 from plants and K2 from fermented foods and animal products. Here's how to get enough. Dietary sources. For vitamin K1, focus on leafy greens like spinach, kale, Swiss chard, collard greens, and Brussels sprouts. For vitamin K2, include fermented foods, natto, aged cheeses, and animal products, egg yolks, liver. Supplements. Those with digestive disorders or on long-term antibiotics may need supplements, but consult a healthcare provider, especially if taking blood thinners like warfarin, as vitamin K affects blood clotting. Practical tips. Add a daily serving of kale to smoothies or include sautéed spinach as a side dish. If you enjoy fermented foods, try incorporating natto or aged cheeses. By boosting vitamin K intake, you'll support bone and joint health, keeping your legs strong and mobile. 7. Vitamin B6, the nerve and muscle supporter. Why vitamin B6 is crucial. Vitamin B6, pyridoxine, is essential for nerve health, muscle repair, and protein utilization, all of which contribute to leg strength. It ensures that nerve signals to the muscles are clear, preventing numbness, tingling, or unsteady walking. B6 also reduces inflammation-related muscle fatigue, improving flexibility and recovery after activity. Additionally, B6 supports red blood cell production, ensuring muscles receive the oxygen needed for endurance. A deficiency can lead to early fatigue, heaviness, and reduced stamina, making even short walks feel exhausting. Consequences of deficiency. Low B6 levels can cause sluggish nerve signals, leading to coordination issues and muscle discomfort. Many seniors attribute these symptoms to aging, when they may actually stem from a nutrient deficiency. How to boost vitamin B6 intake. Vitamin B6 is abundant in many foods, making it easy to incorporate. Dietary sources include poultry, fish, salmon, tuna, bananas, potatoes, chickpeas, and fortified cereals. Recommended intake: aim for 1.5 milligrams women or 1.7 milligrams men daily. Avoid excessive supplementation, as high doses can cause nerve damage. Practical tips. Add chickpeas to salads, include salmon in weekly meals, or snack on bananas for a B6 boost. If you have digestive issues or dietary restrictions, consult your doctor about supplementation. By maintaining B6 levels, you'll support nerve function, muscle resilience, and overall mobility. Conclusion: building a foundation for strong legs. Strong legs are the cornerstone of an active, independent life. By prioritizing vitamin D, calcium, vitamin B12, magnesium, potassium, vitamin K, and vitamin B6, you can support muscle strength, bone health, nerve function, and circulation. Incorporate nutrient-rich foods into your diet, consider supplements when necessary, and pair your efforts with weight-bearing exercises like walking or resistance training for maximum benefits. Always consult a healthcare provider to tailor your intake to your specific needs, especially if you have underlying health conditions or take medications that affect nutrient absorption. With the right nutrition and lifestyle, your legs can carry you confidently into a healthier, more vibrant future.